Hello, my name is A.J. Cardinale, and I'm one of the cardiac surgeons here at VCU. I'd like to take this opportunity to talk about some of the translational research projects being undertaken here in the division and in my laboratory. As a cardiac surgeon, I've had a long-standing interest in heart disease, and specifically heart disease that affects our surgical population. In this regard, I have two areas that are active and that bridge my clinical practice with basic science interests. The first project focuses on developing new surgical approaches for managing endocarditis in high-risk populations. As we know, IV drug abuse is on the rise, and with it comes specific challenges for treating this disease. Recidivism rates are high, and reoperative mortality can exceed 50% in patients with prosthetic valve endocarditis. Therefore, we've taken a bedside-to-bench approach to try and develop novel techniques for managing this disease. We're creating valves in the operating room using native pericardium with the hope that these cellularized tissues will serve as an ideal substrate for tissue valve development and be more resistant to infection. In this feasibility phase, studies are being carried out using large animal models, and we welcome resident and fellow participation in these surgical projects. Our second area of focus involves identifying molecular mechanisms that trigger right ventricular dysfunction in the postoperative cardiac surgery setting. Although most research efforts focused on the left ventricle, the right ventricle is uniquely susceptible to injury in the setting of cardiopulmonary bypass, and the mechanisms leading to this life-threatening complication are largely unknown. As surgeons, we have a unique ability to obtain human tissues, which provides an ideal platform for studying disease processes. In this regard, we've created a large cardiac tissue bank, and we've undertaken both genomic and transcriptome analysis to better understand disease processes involving the right ventricle. Our research has identified cardiopulmonary bypass-associated hemolysis as a central infector in the development of post-cardiotomy right ventricular dysfunction. Studies are ongoing, and we've applied for NIH funding to support these research efforts. This is just a short overview of the research opportunities available in our department. VCU has a long history of research excellence in the surgical sciences, and we aim to continue this rich tradition in the Division of Cardiac Surgery. In addition to the basic science research efforts, we have an active clinical trials program and numerous opportunities for outcomes-based research. We welcome you to VCU. Thank you very much.
Hi, my name is Mohammed Khader. I am one of the staff surgeons in the Division of Cardiothoracic Surgery at VCU. Besides patient care, I do some research, both basic science and clinical outcomes. My basic science research is focused on organ preservation, whereas the clinical outcome research is mostly related to heart transplantation and mechanical circulatory support devices.
Hi, my name is Walkerilliard, and I'm a new thoracic surgeon here at VCU. I joined faculty in September of this past year, and I practice general thoracic surgery and have a particular interest in advanced lung cancers and lung transplantation. Since starting here at VCU, I've been active in both clinical and basic science research. My basic science research interests involve the adaptive immune system and how environmental factors can alter the host's immune response. Specifically, I'm interested in looking at how the environment alters T-cell differentiation, leading to either inflammatory or regulatory type T-cells, and how this change in response dampens or accelerates lung transplant rejection. My lab is within the Department of Surgery, but I collaborate with many other clinician researchers in the Department of Medicine and Pulmonology. Using mouse models and human tissues, together we are hoping to improve outcomes for these complex patients.